Greetings, Anonymous. This is video number 8, and will be part 1 in a 5-part series on healthcare reform. Originally, I intended on doing healthcare reform all in one single video, but as I began putting things together, I just realized that it wasn't going to be possible to do it in one video. It would easily have come to at least 90 minutes and would still have required me to leave out things that I absolutely wanted to mention. So rather than make one big, long, extremely painful video that didn't have everything I wanted in it, I just broke it down into 5 parts. The first 4 parts deal with the 4 main problems that are causing healthcare costs to be as high as they are, along with my proposed solutions for those 4 problems. The first 2 of those problems deal with tort reform and insurance. These 2 problems have been discussed fairly heavily by politicians and radio talk show hosts alike, and I actually find myself agreeing with at least some of these people, to at least some extent, on what needs to be done in those areas, but they're not really the major problems. The third problem I've only heard addressed once or twice by anybody, and never really any real good solutions proposed. And the fourth problem I have actually never heard discussed by anyone. I'm not saying no one has, but I've never heard it mentioned. As far as I'm aware, I may have figured it out entirely by myself. But this is actually, as far as I'm concerned, the single biggest problem with healthcare, and most people are completely unaware that it's even going on. My 5th video in the healthcare series, though, will have to do with heart disease, diabetes, and cancer. These are the 3 biggest health issues people face in our country, and after I point out the 4th problem with the healthcare industry as a whole, the solutions to these 3 problems become a lot easier to address, so I'm taking care of that after the 4 problems. There is actually one additional area that does cause a rise in healthcare costs, at least in some areas, that I won't really be addressing in this series, at least outside of right now. But that would be illegal immigration. This is because some illegals will receive healthcare services and then never pay for them. Sometimes this is because they just don't want to pay for stuff. They're just being kind of scumbags, I guess. Sometimes it's just because they come here, they receive some healthcare services, and then before they are able to pay for them, they get deported. However, they may have had an intention to pay for them, but the only thing that they actually did wrong was entering the country illegally, which I still do not condone, but it does nevertheless make it difficult for them to pay for healthcare service if they're no longer in the country. What happens, though, is when illegal immigrants do not pay their bills, it causes doctors and hospitals to have to raise their rates for their services to compensate for what they didn't get from these illegals. This is mostly in effect along the border states, and even then mostly concentrated in the border towns, but it does kind of have somewhat of an impact on the system overall. But I actually address this, I believe, sufficiently with my immigration policy and my tax policy. At least a combination of the 2 pretty much takes care of at least the vast majority of this anyways, so I'm not really going to propose any further solutions to this. You'll just have to wait for those 2 particular things to come out. On top of that, this is, as far as I'm concerned, a very minor problem compared to 2 or 3 of the other problems. So it doesn't really need addressed in this particular series anyways. It's going to be long enough anyhow. So that said, let's just get started with this video's topic, which is tort reform. For those of you who have either never heard the term or are at least unaware of what it means, basically tort reform is just a term for legislation that would limit the liability of someone doing a good or service or selling a product. In this case it would be doctors against malpractice suits. Under the current system, if a doctor were to misdiagnose someone for just about anything, they can be sued. If they lose, which would at least seem fair if they are at fault, they will often have to pay a settlement. Now, there's nothing wrong with that. I'm not really taking any, I'm not disputing this practice at all. What I do take issue with is the insane amounts of money that people are winning in some of these settlements. What tort reform aims to do is put limits on how much people can sue a doctor or hospital for. For example, if you came to a doctor complaining of chest pain and a cough, he may diagnose you with bronchitis. And it's not an unreasonable diagnosis in most cases, at least with that limited amount of information. Since bronchitis does cause exhaustion of the muscles around the rib cage, that would cause some chest pain. But it's entirely possible, also, given these same symptoms, that a person could have a tumor in one of their lungs, or between their lungs, or at least somewhere in their chest, but or pressing up against their lungs, that is. But if this is a cancerous tumor, then the doctor would have then missed a life-threatening condition, at least an immediately life-threatening condition, and instead diagnosed the person with something that has very little chance of actually being life-threatening. Bronchitis can progress to pneumonia, which can, in somewhat rare cases, cause death, especially if left untreated. It's not nearly as certain as, say, a cancerous tumor. More importantly, though, the treatment that you would give someone with bronchitis is completely ineffectual against treating a cancerous tumor. So, it's also possible that if left untreated for another month or so, the window of opportunity where that tumor could have successfully been dealt with may have passed, which would then leave the patient now in an unrecoverable state. Suing the doctor for the misdiagnosis may be a fair thing to do, particularly if the doctor did absolutely no tests to confirm that bronchitis was the cause of the symptoms. However, I would argue that to award $20 million to the patient, or to the patient's family, would be a bit excessive. I know that you can't put a price tag on someone's life, but you can put a price tag on medical care, or on good medical care. Certainly, a full refund of anything the patient spent for the incorrect diagnosis is absolutely, inarguably owed, along with any lawyer and court costs incurred in getting that judgment. And I think even some degree of pain and suffering or personal loss compensation would also be in order, especially if that window of opportunity had passed, where the person could successfully be treated. Personally, the formula that I would use to calculate pain and suffering would be much different than what is used right now, which is actually pretty much just assigning an arbitrary number, as large as you can possibly think of, to whatever it is you're trying to get, which is mostly, as far as I'm aware, mostly due to trial lawyers, but I would use this formula. First, you would take the average life expectancy in the United States minus the age of the patient. If that, excuse me, if that number would calculate to less than 10, then just use 10, and if it calculates to more than 30, just use 30. Multiply whatever your answer is by the average household income in the USA. I believe currently that number stands right around $42,000. So, assuming the average life expectancy in the U.S. is 77 years old, which I believe is at least very close, and the age of the patient is 57, the difference would be 20, which, when multiplied by 42,000, gives us $840,000. Add to that the court and lawyer fees, let's just say $15,000. I'm not entirely sure how reasonable that is. I have been fortunate enough to never need legal counsel, and then also add a refund of the original costs of the incorrect diagnosis. This can range drastically depending on what hospital, what doctor, and what area of the country you're in. In my area, I think $500 is probably at least somewhat likely, especially if the doctor did not do additional tests. But that would total $865,500, which is a fair sum of money, but considerably less than the $20 million that some people may be getting. This number is still large enough to dissuade doctors from making careless mistakes, but it's small enough not to completely destroy a doctor's practice for just making one or two mistakes. But now that I've covered my recommendation for calculating pain and suffering now, I'll explain how the doctors and hospitals actually pay these settlements. Some of you might already know how this works, but for those of you who don't, few doctors, if any, actually keep millions of dollars just laying around to pay these settlements with. Most doctors don't even have millions of dollars personally. They may have $1 million or a couple $1 million worth of assets, but not in cash where they can just dish it out. What they do have, though, is liability insurance. This works similarly to your healthcare insurance. They would pay a monthly premium, and in the event that they have a liability event, like a malpractice suit settlement, then the insurance would pay that settlement on their behalf. I believe that they most likely have some sort of a deductible, but I'm not absolutely sure on that. What does happen, though, is that if a doctor has any significant number of settlements, possibly sometimes even just one, his liability insurance premiums will either go up, or his insurance carrier will decide not to insure him after his current term expires. In the second case, he'll have to find a new insurance provider, and given his history, which now has a blemish on it, he will not likely qualify for a rate as low as he had before, so his insurance rates will be higher either way. And since the doctor will now have to pay more for his liability insurance, he will likely have to raise the price of at least some of his services to compensate for this increase in expenses. After all, if you made a living selling t-shirts and you buy shirts for $5 and sell them for $10, assuming for the purposes of this scenario that that's your only expense is the cost of the t-shirts, you're making a pretty decent profit. $5 a shirt. But if your supplier increases their price to $7.50 a shirt, then your profits will go down a lot. Now you have to sell twice as many shirts to make the same amount of money, since now you're only making $2.50 per shirt when selling them at $10 a piece. Your only other option, other than selling twice as many shirts, is to raise your price to, say, $12.50 a shirt. So now you can sell the same amount of shirts and make the same amount of money. You're still making $5 on each shirt. However, there's still a disadvantage here. Because while you may have sold a certain number of shirts in the average week at $10 a shirt, people are less likely to buy as many at $12.50 as they were at $10. Anytime the price of something goes up, in most categories, the consumer's desire to purchase that product will go down. So you are likely to sell less shirts at the new price anyways. So you'll actually still have to sell more shirts or raise your price even more so that you're making even more money. And it's really hard to find that exact line where you'll actually make enough money to cover all of your expenses and make the same amount you were making before. It's almost impossible to predict where the market's going to go on that. But the doctor has an advantage that you don't. Unlike t-shirt guys, who will pretty much always see a decrease in sales when they raise their prices, the doctor won't see a decrease in sales. He'll see an increase in complaints about his pricing. But that's because people don't have nearly the same choice on whether or not to buy health care as they do t-shirts. If you are in need of health care, you pretty much have to get that health care. It's not like a t-shirt. So, this rise in the doctor's insurance costs results in a rise in his prices, which in turn results in a higher general cost of healthcare services, which then results in higher insurance premiums for you. And that will be my topic for the next video. Thank you for watching. I know my solution for this particular problem isn't anything revolutionary, especially if you've been listening to anybody else, but it is nevertheless effective. But if you haven't already, please subscribe to my YouTube channel and go to the party's website, www.anonymousparty.org. Sign up for the forums. There's starting to be a little bit of activity going on there, some conversations, not a ton yet, but it's starting to build. But if you've been participating in Project Anonymous Goodwill, I'd like to say thank you. If not, please go watch the video, which is available on YouTube and on the website, and do whatever you can. This is an excellent opportunity to raise awareness for what I'm doing, what hopefully some of you are at least considering doing as well. We still need some people to run for other offices, hopefully this November. Project Anonymous Goodwill, I've been having a little bit of fun with it myself. I've done a few things, but to make it easier on myself and not have to print them myself, I actually just had 500 business cards printed out for it, and I've been using those. I'll try to remember to get them scanned and put up on the website or something sometime soon, so you can see what they look like. You can make just about whatever you want, as long as it has some specific information on it, preferably directing people to the website and describing just at least very briefly what the project is about. But I got mine from a promotion from Vistaprint. I only paid about, I think, $10, but it really doesn't matter where you get them. If you find a better deal, go for it. If you have something against Vistaprint and want to go with somebody else, I'm not recommending one way or the other. They did a fine job with mine, but it doesn't really matter. What matters is that the project succeeds. It's an awesome way to spread the word while also demonstrating your care for the rest of America. Also, if you have any ideas or concerns about what I'm doing or what the party is doing, feel free to post those on the forums as well. Personally, I love hearing from people, especially when it's ideas, and almost as much, maybe even the same, when it's constructive criticisms. I certainly don't mind the encouragements that some of you have given as well. I may not be able to use every one of your suggestions, but I will always at least give it a fair consideration. For those of you who do care about your country, though, and you want to do something to fix it, you can. Don't let anyone tell you it's impossible. I've had several people tell me that. That's exactly what they want you to think. Don't let them tell you it's impossible or that the existing system has too much of a hold on the people. Giving into the system only strengthens that hold. Our founding fathers did not have that same attitude. They essentially signed their own death warrants when they signed the Declaration of Independence. To tell the most powerful nation on earth that you are no longer going to support them, to tell them that they no longer owned you, and to get out, just nothing, we don't want anything to do with you anymore. That was about the most impossible situation that our founding fathers could possibly have put themselves in, but they did it anyways. Not because they believed that they couldn't lose, or even that they had a reasonable shot at success, but because they believed that they were losers if they didn't try. They believed in freedom, and they knew that they didn't have it. Only a loser would ignore the opportunity to get that freedom back, even if it is unsurmountable odds against them. And I'm here to tell you that I'm no loser, and I hope you're not either. I'm not saying that only losers would vote against me, but only a loser would agree with me and then vote for someone else just because they felt I didn't have a chance. If you're going to vote against me because you don't agree with me, not because you don't think I have a chance. Vote for who you agree with. Together, we can change American politics for good. We have that power. because we are the people.